Dr. Ken Landau. Thanks for watching. Let's talk about Prilosec or Omeprazole. This is a PPI, a proton pump inhibitor, a heartburn pill. It was discovered in 1979, approved by the FDA in 1989. It's on the World Health Organization list of essential medicines, and it's the 7th most commonly prescribed pill here in the United States, with more than 70 million prescriptions a year. The principal uses of the drug are for gastroesophageal reflux disease or heartburn. Sometimes the heartburn can be so severe you can get erosions in the bottom part of the esophagus, erosive esophagitis we call it. The pill is used to heal the condition and to maintain the healing. It's used for peptic ulcers, gastric ulcers, commonly called peptic ulcers, used as part of the triple or quadruple antibiotic therapy for 7 to 14 days, and it's used to prevent upper gastrointestinal bleeding in high-risk individuals, and it's also used to treat people who have massive hypersecretion of acid, something we call the Zollinger-Ellison syndrome, and a variety of other conditions that are relatively uncommon. Now, the drug is frequently used at higher doses and for longer periods of time and for indications that it wasn't originally meant to be. So in Italy, about 60% of the people are taking the medicine for conditions outside of the indications for dyspepsia or vague digestive disorders or food-related difficulties. And in Ireland, people are taking it oftentimes at considerably higher doses than it was meant to be. About 2/3 of the people actually doing that. So in the United States, it appears that as many as 1 in 6 people are taking the proton pump inhibitors. There are a variety of them. This just happens to be the most popular. There's recent evidence that links it, not necessarily cause and effect, but if you take it, and if we look overall, we find that people who are taking the drugs have a higher overall mortality rate, a higher incidence of cardiovascular disease, higher incidence of chronic kidney disease, and a higher incidence of upper gastrointestinal cancers. Now, the PPIs are ubiquitously used for managing gastrointestinal acid-related disorders. So gastroesophageal reflux disease occurs in about 10 to 20% of individuals. Peptic ulcer disease, about 5 to 10% of individuals. People are using it to prevent stress ulcers, especially hospitalized patients, very frequently used for upper gastrointestinal bleeding prevention in people who are taking the anticoagulants, or people who are taking aspirin, or people who are taking the nonsteroidal anti-inflammatory drugs. Now, the initial treatment with a PPI, with the Prilosec or the Omeprazole, is really meant to be for 4, maybe 8 weeks, depending on the condition, and then a person should step down, even though you might want to continue taking the medicine, and even though you might fear that if you stop the medicine, you're going to have a reflex of hyperacidity, a rebound of the hyperacidity. And even though the doctor doesn't have enough time to sit and consider, you really need to get off of this kind of a medicine. It's not meant for long-term use in the overall majority of people. Now, if you have uncomplicated gastrointestinal disease, you should regularly attempt to either get off the drug or at least to decrease the amount of the drug that you're continuing. It's not meant to be taken for long periods of time without attempts to decrease the dose, at least decrease the dose, if not to get off of it. And actually, most of the complications are occurring when people take more than they're supposed to for longer periods of time. If you take it for a short period, if you take it for appropriate indications, okay, no argument. So the effects at changing doctors' habits, unfortunately, have proven not to be effective. Doctors continue to prescribe the medicine, and now, on top of everything, you can get the medicine over the counter. Just go over to the grocery store, go over to the drugstore, go over to the convenience store, and you'll find medicines in the proton pump inhibitor family. The medicines come as capsules and tablets and suspensions. You can even give it in the hospital intravenously. Most of the pills are enteric coated because of the rapid degradation of the medicine in acidic environments, like in the stomach. So it's enterically coated. Well, not everybody can swallow the tablet, so if you want, you can put it in a little bit of applesauce. Open the pill, put it in a little bit of applesauce that's room temperature, not hot. And then you can swallow it immediately with some cool water. You don't chew it. It's going to be about a 25% reduction in the maximum concentration in the blood, but overall it's probably going to be quite effective. The dose, if you have a duodenal ulcer, well, it's probably about 20 milligrams a day, and you only do it for 4 weeks. If necessary, you could take it for an additional 4 weeks, but not forever. If you're taking it for eradication of the bacteria that causes the duodenal ulcer, gastric ulcer, the Helicobacter pylori, well, it all depends on the dose of the antibiotic you're taking and the schedule of the antibiotic. Usually it's either a 10-day or a 14-day course, and you take the pill, take the Prilosec, the Omeprazole, several times a day during that time period. And if you happen to have an active ulcer, well, then you could continue it for the 4 weeks or perhaps for the 8-week time period. Gastric ulcer, instead of the 20 milligrams with the duodenal ulcer, we take 40 milligrams. If there's no esophageal lesion, you take it for 4 weeks. If there is an esophageal lesion, you take it for 8 weeks. For just plain old gastroesophageal reflux disease, a lower dose, 20 milligrams for 4 to 8 weeks. 4 weeks without any erosion in the esophagus, 8 weeks if there is an erosion in the esophagus. To maintain the healing, the 20 milligrams a day, you might want to continue for up to about 12 weeks. Longer than 12 weeks, we don't have any really good information. Those pathological hyperacid states like the Zollinger-Ellison syndrome or multiple endocrine adenomatosis or systemic mastocytosis, you have to take an enormous amount of the medicine. You could take 60 milligrams up to 120 milligrams 3 times a day. You can even take it if you're a child between 1 and 16 years of age. A dose, depending on your age, of anywhere between 5 and 20 milligrams. Depends on age, depends on weight. Now, it's possible that if you happen to have an erosion of your esophagus, you're going to have to take it a long time. But if you also happen to have something wrong with your liver, then you might need to take a lower dose. So with liver impairment, a lower dose necessary. Renal impairment doesn't seem to make any difference. If you happen to be Asian, then you have to take a reduced dose most likely because of certain enzymes that are present. You seem to, as an Asian, have about a 4-fold increase in the concentration inside the blood. So a reduced dose is necessary. Remember, you take the pill for the lowest period of time and at the lowest dose that's possible. The kind of dose we have is 10 milligram, 20 milligram, 40 milligram, or we have oral suspensions, 2.5 and 10 milligrams. It's okay to take the medicine with some antacids. If you happen to have gastroesophageal reflux disease, the prevalence can be as high in certain areas, about 25–30%. About 10% of the people who have gastroesophageal reflux disease get those erosions in the esophagus. It's often said by your doctor that, well, you should lose some weight, you should elevate the head of the bed, you should discontinue some alcohol or tobacco. Usually those things don't seem to work. So if you take the Prilosec or the Omeprazole for gastroesophageal reflux disease, the first resolution of the symptoms generally comes within a day up to about a week. The response, if you happen to have gastroesophageal reflux disease, is more rapid than if you happen to have peptic ulcer disease. If you have gastroesophageal reflux disease or heartburn, the likelihood of your being better with a 20 milligram pill is about 60% in the period of about 4 weeks. If you have 10 milligrams that you're taking, well, only about 35% of the people get better. That compares to placebo, only about 15% get better. So there's no question the drug seems to work very well. If you have a duodenal ulcer, to get it to heal, 20 milligram dose is enough for about 2 weeks. Then you have about 41% healing versus 13% with the placebo. If you take the 20 milligrams for 4 weeks, 75% of the people going to be healed versus about 30% with placebo. Pain relief is both daytime and nighttime. It's significantly faster with the Prilosec than it is with the placebo. We have complete relief that's much more common with the Prilosec than with the placebo. duodenal healing is faster than if you took ranitidine. Ranitidine is a pill, again, over the counter. It's a histamine blocker. You could take that at a dose of 150 milligrams twice a day. Well, if you compare omeprazole at 20 milligrams once a day, after 2 weeks, 40% of the people were better, 30% with the ranitidine. But after 4 weeks, 80% of the people better with the omeprazole versus only about 60% with the ranitidine. Another study compared the 20 milligrams to the 40 milligrams of omeprazole. Didn't seem to make any difference. The healing rate at 8 weeks, about 100%, if you take 20 milligrams of the omeprazole, if you take 40 milligrams of the omeprazole, and it's close to 100% if you take the ranitidine. So the ranitidine seems to work as well. It just takes a lot longer to get you there. Now, if you have the duodenal ulcer, and we eradicate the bacteria, that Helicobacter pylori, the likelihood of you getting another duodenal ulcer, having a recurrence, is between 5 and 8%. On the other hand, if we don't eradicate the Helicobacter pylori, if you don't take the antibiotics with it, the likelihood of your getting a recurrence is somewhere between 40 and 60%. Now, with gastric ulcers, so instead of a duodenal ulcer, the duodenum is the small intestine, the first part of the small intestine. If we look now at the stomach, the gastric ulcers, healing isn't quite as good. So if we take the 20 milligrams of the omeprazole for 8 weeks, healing rate's going to be about 75%. But if we take 40 milligrams, it's going to be over 80%. On the other hand, if we take the ranitidine, it's probably about 80% also after 8 weeks. Placebo, it's about 50%. So the moral of the story is, if the gastric ulcer is less than a centimeter, if it's less than a centimeter, so less than half an inch, the 20 and the 40 milligram omeprazole are about the same. If it's more than a centimeter in diameter, then the 40 milligrams seems to work much better. Now, what's the idea? Is the omeprazole able to kill the Helicobacter pylori? No, it's not. It has nothing to do with that. But what we know is that Helicobacter replicates when the stomach is sort of neutral pH, not acid. So when it's up around 6 or 7 for a pH. Normally the stomach, if we're talking about the acid production, is down 1, 2, or 3 for a pH. So at a pH of 3 to 4, the Helicobacter is in a coccoid form, and the coccoid form resists antibiotics. So the whole purpose of taking the omeprazole or any of the other PPIs with the antibiotics to kill the Helicobacter pylori is that we raise the pH, so we get the Helicobacter pylori into its susceptible state. And in the susceptible state, at a neutral pH, the antibiotics can kill it. So to keep the pH relatively high, we take either a high dose of the Prilosec or the omeprazole, or we take a double dose. Now, to heal the esophageal erosions, after about 4 weeks, only about 40% of the people are healed versus about 10% with placebo. But after about 8 weeks, so 2 months of therapy, we can get about 75% of the people healed versus only about 15% with placebo. And the 20 milligram and the 40 milligram seem to be about the same, so you can take the lower, safer dose. And there's no question Prilosec works better than control and works better than ranitidine at both daytime and nighttime. No question about that. So, how about these hypersecretory conditions? The hypersecretory conditions, like the Zollinger-Ellison syndrome and the multiple endocrine adenomatosis that we talked about, well, that requires enormous amounts of the medicine. Now, the ear, nose, and throat doctors have gotten into the act, and they say a lot of the hoarseness or the irritation in the back part of the throat, laryngotracheal conditions, may be caused by reflux disease. So they say that if they prescribe the omeprazole for a period of anywhere between a month and 24 weeks, they can get healing in somewhere between about 20 and 90% of the individuals. But they need improvement in the diagnosis. It's not very good. The diagnosis is very common in ear, nose, and throat clinics, up to 10%, but it's a controversial condition, and we don't really know that the PPIs are superior to placebo, but we do know if you give somebody some kind of medicine for a long enough period of time, oftentimes the natural history of the disease is it's going to get better. So does the medicine really improve laryngotracheal conditions caused by acid reflux, or theoretically caused? We don't know. Problems with the medicine? Sure. You could have anaphylaxis, allergic reaction to it, or shock, or angioedema. Some people develop some bronchospasm. And then we have some kidney conditions and hives. But the important caveat of taking the medicine is, if you happen to have a gastric ulcer and you take the medicine, the symptoms go away, the symptoms going away doesn't mean that you don't have cancer. So you still need evaluation. You can develop atrophic gastritis when you take the medicine for a long period of time. And Clostridium difficile, a bacteria, can grow. And unfortunately, it can cause massive diarrhea, massive gastrointestinal disease, sometimes fatal. Again, a reason for taking the lowest dose for the shortest period of time. The drug can lead to increased bone fractures of the hip and the spine and the wrist, especially if you take multiple pills a day, multiple times a day, and especially if you take it for a prolonged period of time. It also can reduce the amount of magnesium in your system. Becomes apparent after 3 months, especially apparent after a year, can lead to some tetany, some arrhythmias, some seizures. Have to be cautious, especially if you're taking some diuretics or digitalis preparations to boot. Have to be careful if you're taking clopidogrel. If you're taking clopidogrel, then unfortunately that's really a prodrug, and it can't be altered into the active drug in the presence of the omeprazole. And you shouldn't combine it with St. John's wort or rifampin. Those medicines are going to drastically reduce the amount of omeprazole in your system. Well, sometimes if you're being evaluated for certain kind of neuroendocrine tumors, you can get false readings if you're taking the medicine. You could overdose on the medicine, but it would take an awful lot of the medicine. And typically all you're going to get some nausea, some vomiting, maybe some confusion and drowsiness and dry mouth. Not a serious condition for the overwhelming majority of people. Now, it can interact with a whole bunch of different kind of medicines. Some of the HIV medicines. Some medicines require an acid environment in order to get absorbed from the intestines, like ketoconazole and iron and ampicillin and digoxin. And as I mentioned, it can reduce the activation of clopidogrel, even if you take it 12 hours away from when you took the omeprazole, especially if you took a high dose of omeprazole. So those two don't seem to mix. And it prolongs the elimination of drugs like warfarin and Valium and Dilantin and some of the benzodiazepines, some of the other benzodiazepines. So you have to monitor the INR if you happen to be taking warfarin. It can alter the absorption of erythromycin. It increases the concentration of tacrolimus and methotrexate. You shouldn't combine it with clarithromycin because each of them increases the concentration of the other, and you don't generally mix it with either theophylline or propranolol. Well, it can increase the concentration of the opioids. So you have to be especially careful if you're taking hydrocodone or tramadol or morphine, oxycodone, those kind of medicines. 1 to 5% of people are going to have the standard kind of side effects. Standard kind of side effects: nausea, vomiting, diarrhea, constipation, little headache, some intestinal gas and flatulence and dizziness and abdominal pain. No difference between the group less than 65, over age 65. Slight increase in the bioavailability of the medicine because it's not going to be cleared as fast in older people as it is in younger people. Half-life is about half an hour in people less than 65. It's about an hour in people over 65. Some issues with the medicine. It can lead to B12 deficiency, iron malabsorption, lead to acute interstitial nephritis, a kidney disease, inflammatory kidney disease, can lead to benign polyps in the stomach, fundic polyps we call them. Doesn't lead to cancer, and they seem to go away once you stop taking the medicine. We don't know that it's for sure safe in pregnancy. Since it can decrease the acid production, it changes the bacteria population of the gastrointestinal tract. Everyone knows about the antibiotics and how toxic they can be to the microbiome or the bacteria in your gut. Well, so can taking omeprazole. There's a report, several reports, of increased incidence of gastric cancer in people taking the medicine. Anywhere between 2.5 and 3.5-fold increase in carcinoids, increase in colorectal cancer. Now, whether that's cause and effect, we don't really know. It seems that people who have gastric ulcer might have gastric ulcer as the first sign of a cancer to begin with. Now, there have been reports of an increased incidence of dementia in people taking the medicine long term, increased by anywhere between 50% and 2.5-fold in population studies in Germany and in Taiwan. The findings are controversial, but we're never going to have long-term randomized control studies because it takes an awful long period of time. But even though the medicine was approved in 1989 here in the United States, it took the FDA until 2010 till they discovered, oh my goodness, it led to an increased incidence of fractures. So they added to the label, they changed the label and added the information saying, hey, if you take the medicine, you have an increased risk of fractures of your femur and your forearm, increased incidence of fracture of the vertebrae. Doesn't seem to be associated with major birth defects, unlikely to be a teratogen. However, in high doses in rats, leads to some lethal problems for the embryo, for the fetus, and even resorption. So what about breastfeeding? Hasn't really been studied. Because of the high plasma binding, there's only going to be a small amount anyway in the breast milk. And since it needs to be enterically coated, the pill, that means that if the baby takes the medicine from the breast milk, it's going to be very rapidly broken down in the intestinal system, so probably not an issue. Well, we have an awful lot of options for other kind of medicines that help reduce the amount of acid. It just seems like the proton pump inhibitors are a nifty way to do it. They actually work on the hydrogen potassium ATPase that's secreted at the surface of the stomach cells, of the parietal cells inside the stomach. And it works on what we call the proton pump. That's the last step in the production of acid. So it seems to be very good at that purpose. Now, it's rapidly degraded in acid. So the inhibitory effect, when you take it, occurs within about an hour of the time you swallow the pill. Maximum effect is about 2 hours. But even though it has a relatively short half-life, like half an hour, it seems to have a duration of inhibition of the acid for up to 72 hours. So how do we explain that? Well, the explanation is because it latches onto the pump and it's not floating around in the system. So after you've taken the pill, for about 4 days, you have a steady state inside your intestinal system. Well, 20 milligram dose is going to inhibit about 70%, 70%, of those proton pump enzymes. Now, if you have a higher dose, it's not going to give you any greater benefit for the overwhelming majority of people, especially because 20% of the pumps are regenerated, newly synthesized every 24 hours. So the greatest pump synthesis occurs during the nighttime hours. If you take a 20 milligram pill, you're going to have the maximum decrease in the acid production after a period of about 2 to 6 hours. But if we look over the course of a 24-hour period, you're going to have somewhere between an 80 and a 95% reduction in the amount of acid that you produce, and it's only going to be mildly increased if you take a higher dose. Once you take the pill, the bioavailability is only about 30 to 40%, complete absorption relatively rapidly within several hours. Peak plasma concentration is going to occur within about half an hour to 3.5 hours. 95% is going to be bound to protein in the plasma. Half-life relatively short, as I mentioned. It would appear that about 80% is going to be excreted in the urine as metabolites. Some of it's going to be excreted in the feces from biliary activity. When you take the medicine, what you should do is you should probably take it first thing in the morning. You should take it with a big glass of water. You should wait 30 minutes before you eat. And that's very important. It would appear, because we need some extra time for the pill to dissolve and to get into the stomach. It gets into the stomach by going through the blood system and then coming back to the stomach from the inside, not from the digestive system itself, but through the bloodstream. It needs the time. If you take it and you have a lot of acid in the stomach, it's going to degrade the medicine very rapidly. Well, there's an interesting story about the synthesis of the medicine. It's manufactured, the omeprazole is what we call a chiral product. So we have two mirror images. We have the R and the S enantiomer. And they're just like the hands. You got your right hand and your left hand. They look pretty much the same, but they're different. Obviously, the thumbs are on different sides. So in the body, it's only the S enantiomer that seems to be active. Sometimes the R gets switched into the S. But the important thing is that as the patent is ran out, AstraZeneca, the drug manufacturer, they said, hey, since the S is the active ingredient, let's just manufacture the S instead of the combination product. So they did that, and they call it Nexium, or S-omeprazole. So another interesting thing about the drug is it was originally launched in Sweden, then came to the United States in 1989 as Losec. But the next year, 1990, the FDA said to AstraZeneca, hey, do us a favor. Let's change the name. Let's have you change the name. Why don't you call it Prilosec? Because unfortunately, the Losec was confused with Lasix. Now, unfortunately, the Prilosec is confused with Prozac. Anyway, the patent expired in 2001, and now we have Nexium, and Nexium has gone over the counter and it's gone generic. So is there any evidence that taking one PPI, one proton pump inhibitor, is any better than taking another one? Nah, there really isn't. Most of the studies that suggest one is better than another are done by the drug company of the more successful drug. But when we look at all of the studies together, they do pretty much about the same thing. So there's no benefit. Now they say that the Nexium is even stronger than the Prilosec. Is it? No, really isn't. They're both about the same. They're going to be, in the course of 2020, we're going to have several additions to the armamentarium to treat either acid reflux disease or to treat the gastric ulcer disease. Those are going to come in the very near future. How much does the medicine cost? Well, cash, it's very inexpensive. You can buy a month worth of omeprazole for anywhere between $11 and $70. $70 is at Walgreens. They tend to be the highest on almost all of the prescriptions. If you have a coupon that you can get for free over at GoodRx or one of those kind of sites, then the drug can be purchased for anywhere between $8 and $30. Again, the highest, $30, is over at the Walgreens. But if you want the brand name for some reason, cash, omeprazole will cost you $350, the Prilosec. And if you have a coupon, it's going to cost you $235. So that's basically the story of omeprazole. It's the original PPI, proton pump inhibitor, now for as little as $11 a month. But the trade price, if you get the brand name, still is much more for one pill than for an entire month of the generic form. Now you have to realize over the period of the past decade or so, we've learned a lot about the side effects of the medicine, and once upon a time people would just take these with abandon, but now we know that once the pill does its job, it's best to taper to a lower dose, or better yet, get off of the drug. Drugs aren't necessarily meant for long-term use, but unfortunately, a lot of us just get in the habit of doing something, and we do the same thing time and time and time again. So, word to the wise ought to be sufficient. As always, thank you for watching. If you enjoyed the show, perhaps you tell a friend, consider subscribing so you'll get notices as we post new shows. As always, we appreciate your interest. I'm Dr. Ken Landau.